Welcome and Yali Madat. On behalf of the Aga Health Board of the United States, we welcome you to a discussion, Living with Long COVID, What You Need to Know. My name is Dr. Ali Jiwani, and I'm an interventional pulmonologist at the Orlando Health Cancer Institute and a national board member of the Aga Health Board of the United States. It is my pleasure to introduce our expert panel today, who will discuss long COVID and answer your questions. We have a lot to talk about, so I'll keep the introductions brief. Our panelists for today are Dr. Faiz Jiwani, an internal medicine primary care physician and medical educator currently practicing in Chicago, Illinois. In his clinic, he partners with patients in medically underserved communities and is an active medical advocate. He has also contributed to medical education and literature on the topics of narrative medicine, medical diagnosis, and global health. He will also serve as our moderator for tonight. Dr. Sana Somani is a stroke neurologist in Washington, D.C. She's an attending physician at MedStar Health and also part of the NIH stroke program, where they lead not only an MRI-based stroke program, but also the only natural history study on stroke in the world. She is also an assistant professor of neurology at Georgetown University. Dr. Somani serves as the non-communicable disease lead for the Aga Health Board for the Northeast. Dr. Asif Najmuddin is a pulmonary critical care physician practicing in Carrollton and Denton, Texas, outside of Dallas. He has been in practice for the last 11 years. He previously served as the health board as the IHPA lead for the Central Region. Finally, Dr. Salima Qamruddin is a cardiologist specializing in echocardiography and women's cardiovascular wellness. She serves as the technical director of echocardiography at Ochsner Medical Center and director of the Women's Cardiovascular Wellness Clinic. A recipient of the 2024 Women in STEM Award from the American Heart Association, she researches heart valve disease in women in advanced diagnostic ultrasound. She holds the Edward D. Froelich Mentorship Chair and actively raises awareness on heart disease in women through research, media, and advocacy. Without further ado, Dr. Faiz Jiwani.
Thank you, Dr. Jiwani. I'm very happy to be joined by my colleagues here to talk about an important topic. But as excited as we are to share some content about this topic, we are also very interested in hearing your thoughts, because we are sure that you're coming with your own experiences and questions. So please do find your way to the Q&A tab at the bottom. It should be in the toolbar, and go ahead and insert your questions throughout the duration of the conversations as we speak, and then we'll try to get to as many as we can before the end of the webinar. So please do put in your questions. We're really excited to respond to them. So with that, I'll go ahead and proceed with a general overview of long COVID, and then we'll hear from each of our colleagues about some of the more specific aspects of them as they relate to various specialties. So I've titled the section here, Acknowledging Long COVID, because it is still one that we are all learning about. This did not exist 6 years ago. And so it is both something that medical professionals are learning more about, as well as those in the community who may have been exposed to this or may have not. Next slide, please. So before we talk about long COVID, I do want to talk about COVID first. So thankfully, at this point, the rates of COVID infection are lower than they've been in the past. So about 1% of visits in the past week to the ER and 1% of deaths in the last week were due to coronavirus. And these are actually less than the respective values for the flu. And a similar trend is true for hospitalizations. And so we are at a relatively lower period in terms of coronavirus infection, but it is still happening. And so it's still important to continue to stay on top of vaccinations and seek that care. Next slide. So when we look at the average or median experience of someone who was affected by the coronavirus infection, as I myself was, and many of you may have also been, we're sort of aware of the general time to recovery. So each bar represents a different wave of the coronavirus infection. And as you can see, this goes from 2020 to about 2023. And in the most recent wave on the far right, we can see that the number of days to recovery is about between 1 to 2 weeks. And it really reduces even with vaccination. But what was soon apparent is that there were a growing group of people who did not have this experience. Their symptoms extended beyond 1 to 2 weeks or months, and sometimes much longer. And so this group began to become prominent and one that was studied in further detail to better understand those circumstances. Next slide, please. Some efforts to try to understand how large that group was have led to an understanding that about 7% of all people have experienced long COVID at some point in their life. And so that means that in our neighborhoods, in our Jamaat khanas, maybe in our families, there are certainly individuals that may be affected by long COVID. Next slide, please. Looking a little bit closer, there were also some other trends that became apparent. It does tend to be more common in women. It's also more common in this sort of middle category of age between 35 and 49 than those who are younger or those who are older. And as you would expect, it tends to be more common in those with a more severe infection. But the most common person to have long COVID actually had a mild infection. Because there were so many more mild infections than severe infections. Just because someone may not have had a severe infection, it doesn't mean that you can't be affected by some of these symptoms. So I just want to highlight that because it can be very relevant for many people. Another thing I wanted to note is vaccination has been shown to reduce the risk of long COVID, even if that vaccination occurred after the infection. So just highlighting the ongoing importance of vaccination. Next slide, please. So as I mentioned before, long COVID didn't exist 6 years ago. And so this is really a new condition that's been identified and elaborated. So this was actually first identified. The term long COVID was coined by patient advocacy groups, people in the community having this shared experience and getting together and publishing on that shared experience. Subsequently, various medical organizations developed definitions, and then there was an effort to look at the various definitions and try to pull together a common definition in 2024. And so I want to read that definition to you right now. So long COVID is an infection-associated chronic condition that occurs after coronavirus infection and is present for at least 3 months as a continuous, relapsing and remitting, which means it kind of starts and can stop, or progressive disease state that affects one or more organ systems. So this is a somewhat complicated definition. And one of the things I want to highlight is that long COVID looks very different from person to person. It can involve shortness of breath that extends, 4 or 5 months. And it can also involve debilitating fatigue and changes to a person's lifestyle and the ability for them to do their work or engage with others in a similar way. And so this is a very wide set of experiences for people. Next slide, please. So when we think about long COVID, many of us may be familiar with some of the more common symptoms of COVID. So cough, fatigue, shortness of breath. But it's important for us all to know that there's actually a very wide variety of symptoms that are included in this descriptor of long COVID. In fact, there's over 200. And so that's the first thing I want you to notice about this slide. It's got a lot of words, and on the right is a diagram that's meant to communicate that it affects almost every organ system. But I also want to bring your attention to the left column. And these are the symptoms that are most common. They include persistent fatigue, which can be severe, difficulty concentrating, shortness of breath, and post-exertional malaise. So after exertion, feeling very tired. And this can affect, the fatigue can be up to 1/3 of those with long COVID. Next slide. Oh, sorry. The other thing I want to notice is that sometimes these symptoms are very hard to describe to a health professional, to a friend or a family member. And so I also want you to see these words as tools to help you communicate also what you're feeling to your medical professional or to your peers. We'll talk about brain fog, which is an idea that, maybe some people have difficulty concentrating or difficulty thinking clearly after an experience with COVID, or if they're experiencing long COVID. This sort of persistent fatigue after exertion. These are all phrases that I think can be helpful in describing hard to describe experiences. Next slide, please. Another way to think of all of those symptoms is in 3 categories: physical, psychologic, and cognitive. Next slide, please. So I've sort of rearranged all of those symptoms into these categories. And so we commonly think of the physical symptoms, the fatigue, which we just talked about, the shortness of breath, muscle pains, difficulty sleeping. But I also want to highlight the frequency or how common it is to have cognitive symptoms and psychological symptoms. Cognitive symptoms are changes in the way we think, the sort of clarity with which we're able to, have a detailed conversation with someone else, or maybe do certain things at our work, or manage a to-do list or multiple tasks, difficulty concentrating, those sorts of things. And then also psychological symptoms, and this can include both new symptoms of depression, anxiety, PTSD, as well as worsening symptoms that may have pre-existed before having the infection. So I just want us to be aware that also when we think about ourselves and our peers, that someone's experience of long COVID may be very different and may also involve sort of more than just shortness of breath. They may also include a pretty wide variety of, significant symptoms, some of which we may not be able to see. Next slide, please. The other thing I wanted to highlight is the words of people who have experienced long COVID themselves. So there was a study of about 50 individuals with long COVID, and it talked to them about their experiences. And so I wanted to just highlight some common themes that came from those interviews. And then we'll kind of look at a few of those specific quotes. So some of the common themes were the emotional landscape of long COVID. Many people have been dealing with, common sets of emotional difficulties. So for example, one has a lot of uncertainty. They don't know how long these symptoms will last or whether it will get better. There's a lot of sort of mysteriousness about what their future will look like. Also with some of the symptoms such as fatigue and this difficulty engaging and keeping up with the same routine as before, sometimes that creates irritability, difficulty managing or controlling emotions. And so that was a common experience of some of the interviewees in this study. Another comment was on limits to daily functioning and loss of former identity, which we'll look at a little bit more closely, as well as this COVID-related stigmatization, this idea of being seen with disapproval by their peers because of their long COVID. And then there's this theme of people learning to cope, finding support groups, finding ways to move forward. Next slide, please. I just want to look a little more detailed at the words that they had used themselves. This first one is a description of brain fog, which can be very difficult to communicate what it is, but I think this is a very enlightening example. I could understand that there's a vehicle in front of me, or if the light is green, or if the light is red. I can see that it is red, but I may not understand what that means, so I don't know where I'm supposed to go, or what I'm supposed to do, or do I drive, or do I not? So this idea of having the slowness of processing previously automatic and sort of instinctive moments. There are other instances of people limiting their own cooking because they were afraid they would leave the stove on or something like that. And then this can also affect people's sense of self and their identity. So here's one that speaks to that. I'm someone who is very productive. I retired in 2017, but since then I haven't stopped. I've been involved in volunteer activities. I was on 3 different boards for artistic organizations across the city. I was working on my own project that I presented in May. I got COVID in June, and it was like falling off of a cliff. I wasn't able to be productive and to contribute to all the things I'm involved in the way I did before. Next slide, please. And then the final category that I wanted to talk about is long COVID-related stigmatization. The way we respond to our peers who may be experiencing this has a pretty strong effect on their own sort of opinions and well-being with this condition. One specific example was this sort of trivialization of experience with long COVID. Here's an idea of that. I do notice it quite a bit through family and workplace. Really, anybody you come in contact with who hasn't experienced it in the way you have, most people think, oh, it's just a common flu and cold and it's all in your head. So when I hear people say it's not real or it's just a flu, I'm hearing that they tell me I am not real. And another. One is from friends. In a way, it is a kind of stigma. Like, oh, you should be better by now. Well, you look better today. You don't look so bad. You'll get over it. And it's like, yeah, I want to. I'm doing everything I ought to be doing to do that, but it's taking time. And the last slide, or the next slide, and the last quote is about feeling that people blame them for getting COVID and then also having to experience these symptoms. I think that people kind of want to say, well, you got COVID, so you have to deal with the repercussions of it, as if I didn't do everything to avoid it in the first place. And even if I hadn't done everything, there are people who are out there experiencing these symptoms that weren't able to do those things to protect themselves. it's still not their fault that they're experiencing the long-term COVID symptoms. And so I just wanted to leave these quotes to really center people who have experienced this and also illustrate what this can look like in day-to-day life, in addition to some of the symptoms that we've discussed. So as I near the end, we'll go to the next slide. I just want to make a comment. There have been efforts to identify medications that were particularly helpful in treating long COVID symptoms. But right now, some of the best approaches to managing these symptoms include physical rehab and mental health rehab, and also a particular form of behavioral therapy called cognitive behavioral therapy. And so these are really steps that have been shown to be very helpful. And of course, it's important to manage underlying medical conditions that might also contribute to these symptoms, and regular visits with a primary care provider and any medical specialist as they're needed. Next slide. And so I just wanted to share some final thoughts. There is skepticism by some medical professionals, by members of the community about whether this condition is real. I was reading a medical paper about this condition, and in the paper itself, one of the authors had written in the introduction that they were unsure when they started this research about whether this was a real condition. And so it's important sometimes that we may have to advocate for ourselves, patients, people may have to advocate for themselves to their doctors and medical professionals to say, hey, I think this applies to me. And also, working to define, describe those experiences to their providers, even if you're not quite sure what they are, just sort of communicating what you're feeling. And that speaks to the second part, that these are vague symptoms. They're difficult to explain, but it's still important to try to communicate those so that your medical professional can have a better understanding of changes that might be occurring. There is symptom overlap. This can overlap with other conditions. And so, if you're speaking with a medical provider and they're ordering some tests, it doesn't mean that they're sort of sidestepping that this is long COVID, but there is an important need to identify whether there are other conditions that might also be contributing that can also be treated at the same time. And the last aspect is that this has a significant and variable impact to quality of life. This is a very different experience person to person. And so as we interact with members in our families, in our communities, in our neighborhoods, in our Jamaat khanas, it's really important for us to have that broader understanding of the experience that long COVID can have, both physically, psychologically, cognitively, and other ways. So that sort of a approach, I think, is important as we support each other with this. So in light of supporting each other, I'll end there and I will pass it on to Dr. Sana Somani, who will speak on some of the neurologic complications of long COVID. Dr. Somani?
Yeah, Al-Madad. My name is Dr. Sana Somani, and I'll be discussing the neurologic complications related to long COVID. Next slide. So these are the objectives of my talk. We will go through how long COVID affects the brain, what are some of the symptoms, how do we diagnose it, what treatments are available out there, and lastly, some take-home points. Next slide. So I know this slide might be a bit complicated for most people, but the basic understanding is that the antibodies produced by COVID can cause dysregulation, which then causes other viruses in the body to reactivate, or it can also cause the body to have an immune reaction against itself, which can then result in these symptoms. Something I would say similar to other autoimmune diseases like lupus or rheumatoid arthritis. Next slide. So what are the symptoms exactly? So first I have on the list is inability to smell and taste. That is something I think most of us felt when we first got infected with the virus too. But for many, these symptoms actually persist beyond that 3-month period. Anxiety, depression is also very common. Fatigue, as Dr. Jiwani mentioned, is probably the most common. बहुत से लोग कहते हैं कि बस अब काम नहीं कर सकते, थकावट रहती है पूरा दिन. That's fatigue. Inability to sleep, headaches, dizziness, this is all very common. And something that many people complain, and Dr. Jiwani also mentioned, is termed as brain fog. It's this memory impairment where people just can't get themselves to function. उनके दिमाग में एक धुंधलापन महसूस होता है, कुछ क्लियर नहीं होता कि क्या करना चाहिए और क्या नहीं. And the last one I have is autonomic dysfunction, which is when your blood pressure and heart rate suddenly change, which can cause abnormal sweating or palpitations also. So these are just some of the neurologic symptoms of long COVID. Next. So now who is at risk? Research has repeatedly shown that young women are more at risk than other groups. So women aged 35 to 49 years are most at risk for the neurologic complications of long COVID. And those who had severe COVID, that is, if you had to be hospitalized because you needed some breathing treatment or ventilator support, then you're more at risk. Then those who already have neurological or autoimmune diseases. So if you have multiple sclerosis or myasthenia gravis, ALS, depression, diabetes, lupus, then you are more at risk for developing the neurologic complications from long COVID. And here it also mentions that 1 in 5 adults actually experience long COVID related major limitations where they're not able to return to work or it significantly impacts their daily lifestyle. Next. So how do you diagnose it? First things first, please discuss this with your primary care provider about your symptoms. So oftentimes people have other diseases which have similar symptoms and are very easily treated, and that is confused with long COVID. So it's very important to discuss with your primary care so they can actually run tests to make sure there aren't other things that could be causing your symptoms. So, for example, being anemic or having thyroid disease or having bad diabetes or low vitamin B12 or vitamin D levels, these can also cause the same symptoms of fatigue and memory loss. And these diseases can be very easily treated. So then if you have these, then your primary care can possibly treat you, and it might not diminish your symptoms completely, but it might help with the symptoms. Then if you have autonomic symptoms, like I mentioned before, they will need to check your blood pressure and heart rate. And if you complain, of course, about memory issues, they might do some memory assessments or tests for depression to make sure you're not affected. And if your exam is concerning, or if you complain about headaches with some concerning symptoms, then your PCP might order an MRI brain to assess for any abnormalities. So these are just some of the things which can be used to diagnose or to exclude other diseases so that we can confidently say that you are probably having long COVID symptoms. Next. Now, coming to the management, there is currently no magic drug or medication out there which can cure or help relieve long COVID symptoms. But what has shown promise is all that I'm going to discuss now. So first is lifestyle changes, and you all know this very well, but sometimes we just need reminders for this. First, starting with good nutrition. So a diet which is rich in fiber, nuts, vegetables, and fruits is ideal. Exercising at least 150 minutes in a week, which is the AHA recommendation. Sleeping well, that is 7 to 8 hours a day. And we are very lucky. Our health board already has a program called 10 Top Tips or Choices for Health, which is targeted exactly at that. So join those programs when they're offered. Avoid anything which triggers your long COVID symptoms, which could be hot weather, alcohol consumption, anything like that. You might be referred to occupational therapy or a psychiatrist or a psychologist for rehabilitation. Take that opportunity. Cognitive rehab has had the best results with long COVID, like Dr. Jiwani mentioned, cognitive behavioral therapy. So please take on that opportunity. If any of your tests are concerning, your primary care might refer you to a neurologist for further management. And then, of course, there is some data that also suggests that if you are vaccinated, your risk of particularly developing brain fog or this memory impairment from long COVID is further reduced. So be up to date on your vaccinations for COVID. Next. Now, I'll go back to my first point of lifestyle changes and cognitive rehab a bit further in this slide. So this picture here tells you what exactly needs to be done, this picture on the left. You basically need to take care of your mental health by practicing self-care. You need to take out the time to breathe, maintain healthy habits, eat a well-balanced diet, What's recommended is mind or Mediterranean diet. Other than that, you have to stay connected with your colleagues and friends, make sure you are sleeping well, staying hydrated, exercising regularly. कुछ रोजमर्रा की तब्दीलियों से काफी मदद मिल सकती है। पहले है नींद। तमाम लोगों के लिए 7 से 8 घंटे नींद बहुत जरूरी है। दूसरी बात, समाजी तौर पर मुतहरिक रहें, दोस्तों से बातें करें, बाकायदगी से मिले, फोन पर बात करें। सेहत बख्श चीजें खाएं, सो कम चीनी, कम नमक, कम गोश्त, ज्यादा पानी, ज्यादा फल, ज्यादा सब्जियां, ज्यादा ड्राई फ्रूट, ज्यादा फाइबर। वर्जिश करें, हफ्ते में कम से कम 150 मिनट, जो कि 5 दिन के लिए 30 मिनट रोजाना होते हैं। पैदल चले, थोड़ी दूर गाड़ी पार्क करें, अगर आप मंजिलें ले सकते हैं तो सीढ़ियां चढ़ें। And lastly, challenge your mind and keep learning new things. I have put here a list of games that can help with memory issues and maintaining your cognition for longer. These are routinely recommended in our memory loss clinics also. So these are all free apps. They're very easily available on your mobile phones or on websites. The New York Times games, Lumosity, Brain HQ, they all let you play a few games for free every day. So I do that. You should try that too. Then there is Sudoku, jigsaw puzzles, crossword puzzles, which you can play physically on paper also or online to keep your mind fresh and also challenge it to learn new things. Next slide. The other thing which has helped is spacing. This is from actually the Long COVID website for kids. It basically tells us that penguins actually get their energy from fish. So each activity they do, they manage their energy accordingly. So each activity you do in your life, you need to figure out how you're managing your energy. So for example, if you feel fatigued and out of energy, the left column, how to gain energy, this is what you need to do to get back. For example, drinking enough water, sleeping well, or asking for help. Then how to actually use your energy sensibly, that's the middle column. For that, sit on a Sunday and plan your week ahead. Have backup plans available. Do what makes you happy. And then this last column, which is on the right, is what actually drains your energy. So this is the stuff we need to avoid. So staying up too late or making poor food choices, worrying, not drinking enough water. So the more sensibly you use your energy and the less you do activities which drain energy, the more you will have energy to conserve and left with you. Next. So I've shared it. There's a link at the bottom, and I'm going to share it on the chat too. I found this link, which is actually a toolkit made by occupational therapists from Manitoba, Canada. And I'll share it. Like I said, it has great mindfulness activities, which do not take a lot of time. And I've just posted some examples here. It should be very effective for those dealing with long COVID. It's very simple things like, pay attention to your taste buds when you are drinking your morning coffee, or pay attention to nature when you are out walking, or listen to the water when you're washing your hands. These don't take time. These are your daily activities, but it makes you more conscious of your senses and connects you with yourself in a world of social media where it's very difficult to even take your eyes off the phone. So simple breathing techniques or even stretches in the middle of the day. These will also help rejuvenate your energy and help you push forward. Next slide. So take home points. Neurologic symptoms यानी एसाबी अलामात लॉन्ग कोविड में बहुत आम हैं. They are very common. अगर आपको इनमें से कोई अलामात है तो प्लीज़ अपने प्राइमरी केयर डॉक्टर से रुजू करें, और ज़रूरत पड़ने पर वो आपको दिमाग के डॉक्टर को रुजू करने का भी कह सकते हैं. जब आप लॉन्ग कोविड के बारे में इंटरनेट पर पढ़ें तो ख्याल रखें कि आप ऑथेंटिक रिसोर्सेज इस्तेमाल करें. आप अपने डॉक्टर से भी पूछ सकते हैं कि कौन से रिसोर्सेज ऑथेंटिक हैं. लॉन्ग कोविड का कोई एक इलाज नहीं है जो आपको बिल्कुल ठीक कर दे, पर जिंदगी में बहुत सी कुछ बुनियादी चीज़ें हैं, उनको तब्दील करने से काफ़ी हद तक लॉन्ग कोविड की अलामात को कम किया जा सकता है. And I think with that, I take leave.
Thank you so much, Dr. Somani. There's so much good stuff there. I feel like I need a copy of the Pacing Penguins energy distribution chart in a prominent place that I see every day. Also, thanks for the plug for primary care physicians. As a primary care physician and medical provider, we love seeing you, and so we'd love to, have you have a relationship with a primary care provider, even when things are good, so that when things are more of a struggle, then we can sort of be a partner in noting some of those changes and really be able to support you through that. So thank you again, Dr. Somani. Next, we're going to talk a little bit in more detail about the ways in which long COVID will affect the lungs. And so I'll pass it over to Dr. Asif Najmuddin to talk about some of the pulmonary complications. Dr. Najmuddin?
Yeah, with everyone, and thank you so much, Dr. Jiwani, for the introduction. Before I start my part, I must admire the and compliment the way both our previous presenters have presented. My goal would be that to not to be redundant as we enter into the latter half of this presentation, and just tailor my presentation or my talk to kind of reiterating the gist of what has already been presented, and then just add a little bit more emphasis on the respiratory aspect of COVID. As we know, COVID-19 is a respiratory illness, so definitely it leaves us with a lot of respiratory complications as well. Next. So again, the gist of Dr. Jiwani's talk was the epidemiology of COVID, and again, the conclusion is that luckily we are seeing a sharp drop in the incidence and prevalence of COVID-19. The rates are even matching or must be less than some of the other top competitors such as flu and RSV. The question is, why are we not talking about RSV and flu and COVID? Is because this is just one unique virus that has led to a lot of post-viral symptoms. This virus, either the virus itself or the immune response to it, just does not leave the human body. There are not too many post-influenza sequelae months after, and the people just do not linger. Either you get better, or you get better with, in Tamiflu, and some unfortunate individuals succumb to it, but does not give you this lingering course. And that's the biggest reason we are talking today about COVID. So luckily, we have had some success in this battle, luckily to the advent of effective vaccines and the adherence, nationwide global campaigns actually, and some effective medications such as steroids, antivirals, and some other immune modulators. And luckily, the incidence and prevalence of COVID has gone down. But since the number of people affected were so many, we still see a fair amount of people that have long COVID, also because long COVID is a protracted disease. So the number of years it affects people is, we still see a fair amount of people still having this. Luckily, the incidence is not going up, so we are hopefully at a plateau and maybe coming down. Next. We already talked about the risk factors, but it just highlights the socioeconomic disparity that the whole world has faced in terms of access to healthcare in the times of COVID. It's a disease of the less privileged people, people with pre-existing conditions, a slight female preponderance, and also the more severe disease you had, the more chances that you have of long COVID. And I think we've already discussed that it's a multi-system disease. Next. So some of the key pulmonary symptoms, I have practiced for the past 3 years in the outpatient clinic setting after COVID, and the two biggest disease pulmonary complications I saw in my clinic practice in the community, and I live in Dallas where we interacted with a lot of Ismaili Jamaati members as well, was a cough that just lingered and lingered after COVID. And sometimes, typically, a post-viral cough should get better within 3 months, but I saw patients for post-COVID cough for almost a year, and this would just not get better. The second problem was scarring of the lung or interstitial lung disease. We may think that people may not be familiar with a disease, a name such as interstitial lung disease or IPF, but serving on the health board in the in the past 3 years, I came across a lot of Jamaati members who have suffered from IPF, and are oxygen dependent. So definitely it's not as rare a disease as I thought, especially in our demographics as well. And COVID causes a disease similar to that. COVID is a disease that is pro-clotting. Also, the vaccines, the Johnson and Johnson makes the most common one, but COVID is a pro-clotting disease, and a lot of these patients have succumbed to blood clots, whether large or small, in the blood vessels, and that also is one of the reasons why people have a wild multitude of symptoms. One of the theory is small blood clots in the blood vessels in all the organs, which leads to this variable symptoms. And then while all these things are ruled out, some people just have breathlessness without any reason, and we'll talk a little bit more about it over the next few slides. Next. So pathologically, COVID, whether in the acute setting or in the late setting, has formed two distinct morphologies. The one type of patients we call the L type. L stands for light. That means if you were to take the lungs out of the body, they will feel light. That means they would not be filled with fluid. And the main reason is in those patients, it is the blood clotting which is causing most of the symptoms. If you do an X-ray or a CT, it would not look as bad as the patient, and the reason is because there are blood clots in the microcirculation, and that's what causes. The second type of disease is the CT or the X-ray looks as bad as the patient, and that's the H type or the heavy type, in which the fluid is the main problem, and it causes impaired oxygenation. A lot of patients have a combination. Some patients starts with the L type and move towards the H type, or some people may just be pure L and H. And these are the two main pathophysiologies, but the end result is the same: shortness of breath, lack of oxygen, and prolonged symptoms. Next. Another reiteration, on the extreme left, you see a patient who has very severe lung injury or ARDS due to COVID. These are some of the patients we have seen in our intensive care units. And then a lot of these injuries and inflammation would lead to permanent scarring, which you see in the middle panel. And you see it not much different from the classic disease IPF that we were talking about. It's the number one cause for lung transplant in the country, and COVID causes a similar disease to that. Some of the medications and therapies that are well known to be effective in IPF have been tried in post-COVID with some success. Next. So what are some of the most common symptoms? Just to reiterate on what I already said, one of the biggest problem is breathlessness, and it's just not shortness of breath. People can have an erratic breathing pattern. They may have episodes of shallow breathing, rapid breathing, and hyperventilation. A lot of these people are dismissed that they are anxious, but actually, scientifically, it's been shown that they have what is called the BTF model, more like a psychological version of post-traumatic stress disorder. And it's really a physical and psychological trauma COVID has been for a lot of our people. It starts off with a breathing problem where they have a functional limitation because of lack of oxygen. Second of all is the prolonged illness, which affects them psychologically. And they always think that they are vulnerable to death or disability. And then all of that leads to significant functional limitation in which they are not able to do the activities of their daily living, also including cognitive impairment. And then most of the rehabilitative therapies are towards unwinding the BTF model. Cough, as I said, is the most common post-COVID symptom I have seen in my outpatient practice. And again, it has been a very hard symptom to treat because it has been prolonged, not very responsive to some of the typical therapies we give for cough. Luckily, we've had some success with management, just like we manage asthma with inhaled steroids. But a lot of these patients have just responded to cough suppressants, but no real treatment. And it's been a challenge, like most of the other things with COVID. Next. So the cornerstone of therapy in COVID is a multimodality treatment. That means you unwind the BTF model, involve your physical therapist, your respiratory therapist, psychologist, and just like we have all the different domains and all the different specialities have all the expertise and work towards the holistic patient. Pulmonary rehabilitation has been shown to be very effective in long-term pulmonary diseases or chronic pulmonary diseases such as pulmonary fibrosis, COPD, pulmonary hypertension. The outcome data in post-COVID is not well studied, and hence sometimes insurance and payers would have a hard time approving post-COVID rehab. But in a lot of other cultures, a lot of rehabilitative therapies, some of these therapies being virtual, such as online singing-based programs and inspiratory muscle training, has really worked for these patients. Next. So again, since as I said, as we go towards the latter half, let's just see how well we have remembered some of the things that all our three presenters have presented. So I'll just have some true and false questions. Long COVID has a wide range of symptoms that can last weeks and months. What do we think? Yes, it's actually a true statement. Long COVID is an illness exclusively limited to older adults. Next. So it's false. It affects all age groups, and especially it also affects children. As we already saw, it's predominantly a middle age and also mild disease, but a lot of kids also having post-COVID symptoms. Repeated infection with COVID-19 can increase the incidence and severity of long COVID symptoms. It's a true statement. Best strategy to avoid long COVID is early diagnosis and prompt treatment. Sounds pretty correct, right? It's actually a false statement. The best strategy is actually to get vaccinated, because once you have COVID, you can really not control if you're going to get long COVID or not. So vaccination still remains the best strategy, as it was discussed previously. And finally, living with long COVID can be difficult and isolating, especially when there's no immediate answers or solutions. It's a true statement. In the end, I would give all of us a link to UT Southwestern website, which has a long COVID clinic and is an excellent resource in which they tell you about an individualized approach to COVID. It has a lot of links for in-person and virtual help. It involves a lot of psychological help, physical therapy help, and pulmonary help. And also give you links, and a lot of other people may not have access to it in person, so you can get a lot of virtual help, an excellent resource. And with that, I will end my presentation.
Thank you, Dr. Najmuddin. Again, that's so helpful. As a primary care provider, dealing with a lot of cough, post-viral coughs, not great to hear about yet another cause, but it is good to hear that there has been some improvement seen in that. Another thing I wanted to know, you use the phrase long hauler, just for the general audience. These phrases there are various phrases used to describe long COVID. They include long hauler syndrome, post-COVID condition, as well as other names. So I just want to highlight that those are all the same thing. Great. So with that, I think we will conclude at the heart of things with Dr. Salima Qamruddin with the cardiac manifestations. Dr. Qamruddin?
Thank you. Thank you, Han Health Board, for this opportunity to present. So let's talk about cardiovascular manifestations of long COVID. My excellent presentations by my co-panelists, and we've already discussed what long COVID is. So many of you that have had symptoms of long COVID, whether it's you, your family members, for more than 3 months, that is considered long COVID. Next. So what I'd like to do is describe to you who are the people, as far as cardiac conditions are concerned, would be at risk for manifestation of heart disease in the long COVID phase. People who have a metabolic syndrome, that is, patients that have a conglomerate of symptoms, including high blood pressure, high cholesterol, high triglycerides or fat in the bloodstream, excess weight, fat around the waist. That combination of symptoms is considered metabolic syndrome. And it seems that patients who have this constellation of symptoms are actually 50% less likely to recover from COVID even at 12 months. So the first thing I'd say is that those patients who have diabetes, who have hypertension, and who have metabolic syndrome, unfortunately, are at high risk to have continual symptoms of COVID after a few months. Next. Well, the next thing to talk about is patients who have pre-existing heart disease are actually 4 to 6 times at higher risk for developing cardiac symptoms of long COVID. So people who have had heart attacks, who have had stents put in their heart, who have had a bypass, those patients unfortunately are more at risk, 28% higher risk of long COVID compared to people who do not have existing heart disease. Patients with congestive heart failure, patients whose heart function is weak, or they have a condition where the heart pump is normal, but the heart does not relax. What condition we call heart failure with preserved ejection fraction, again, seen much more commonly in older women. If you have those symptoms, and it is due to high blood pressure that heart failure with preserved EF exists, patients with those symptoms appear to have high risk for developing symptoms of long COVID. Next. This is just, again, a reminder of what has already been talked about. That is, why do these symptoms persist? And the theory, as far as the cardiovascular sequela of long COVID is concerned, is the activation of the immune response and autoimmune activation that tends to affect, with like other organs, the lungs, the brain. It also causes inflammation of the heart, and that triggers a cascade of symptoms that are expressed in different symptomatology. The most commonly encountered symptoms are chest pain, shortness of breath, palpitations, and syncope. Next, and we're going to go over it one by one. It's also important to know that patients who develop long COVID actually are more likely to develop new heart symptoms. In other words, you've never had any heart disease symptoms, but you're likely to develop new symptoms post-COVID. And the explanation for that is that you get this inflammation is triggered. It's almost like you have poor reserve. If you have poor cardiac reserve, it's manifested for the first time after a stress response of long COVID. And the heart condition is now manifested after the stress of long COVID. So in a very large study of 47,000 patients, patients with major adverse heart-related conditions were about 1.5 times more frequently encountered in patients with long COVID compared to controls. Next. So the most common manifestation of the heart that can persist 3 months after COVID is palpitations. Very common, and there are different types of palpitations. These heartbeats could be fast, regular. They could feel like irregular heartbeat. आपकी दिल की धड़कन तेज हो रही है, लेकिन वो जो है वो regular नहीं feel होती है, irregular है. इसके अलावा you can get your heart can feel like it can skipping a beat, which is a sign of premature contractions from different chambers of the heart. You can feel a sensation of fluttering or in the chest. Fluttering in Urdu is very hard for me to describe, but essentially the heart it feels regular, but it's a very soft palpitation rather than heart palpitations. There can be chest discomfort along with palpitations, and your heartbeat can just feel like it's going fast. Now, this is really important because the good news is that most people who are having palpitations during COVID, in fact, are just having heartbeats that are fast, but they're in fact regular. And there's nothing wrong with the heart except that it's manifesting all the fatigue and other symptoms. It's a manifestation of other different conditions, including cardiac conditions, that the heart can go fast. It's important to recognize that. Many of you that have an Apple Watch or a Fitbit, if you see your heart beats above 120, resting, you're not doing anything, and your heart beats fast, do consider getting a referral to a cardiologist. We would run an EKG. We would make sure that, in fact, the heart rhythm is normal. And in many cases, we would offer you an event monitor or a Zio patch or one of those monitors where you can put the monitor on for 2 weeks to a month, depending on what the condition is and what the concern is. And especially in patients who have high blood pressure for a number of years, it may be the first time that you are triggering in fact an irregular heartbeat called atrial fibrillation that increases the risk of stroke. So it is very important to try to ascertain what is the nature of the palpitations that you're having. Next. The second most common manifestation of COVID is development of hypertension. High blood pressure for the first time can manifest right after COVID or during the long COVID phase. And again, this has been shown in multiple small and larger studies that that is the case. So especially for our middle age to older age patients, if you do not have high blood pressure and you're experiencing new symptoms of fatigue, headaches, irregular heartbeat, nausea, fainting, this could be a sign that you're developing hypertension. Certainly can get a baseline blood pressure. You can have a blood pressure cuff that you have at home, that you can get it or through one of the primary care clinics. But you have to routinely check your blood pressure to ascertain at least 2 to 3 readings to be able to confirm that in fact your blood pressure is above 140 by 80, which is by the American Heart Association the standard for stage 1 hypertension. Next. Now, the other thing that Dr. Najmuddin talked about is the fact that during COVID, with the inflammation, there is a cascade of blood clotting disorders that are activated, because of which there is increased risk of blood clots that can develop. So one of the common symptoms, at least we see in the cardiovascular clinic, is that we see patients 3 months out after COVID come in with a swollen leg that is red, and it's painful to touch, especially in the calf. And it turns out that they have a clot in one of the veins of the legs. Now, this can be really painful, so you would certainly seek care. Next slide. But what is difficult, more difficult to diagnose at times is patients, this blood clot that is in the vein in the leg can travel to the chest, to the arteries of the lungs that can cause a clot inside the artery. Now that will reduce the oxygenation of the lung and can make one feel really short of breath. Now this occurs in 9% of the patients that have long COVID, and this is in fact one of the regular inpatient diagnoses that we see for people that have long COVID that come in 3 to 6 months after COVID. This is the symptoms of acute pulmonary lung embolism or clot in the lung is acute sudden shortness of breath, the heart is racing, and your oxygen levels drop. You could be having cough, chest pain is common, but the fact that when you come in the emergency department, your pulse is 120 and your oxygen levels are reduced, they are typically the signs that we see in cases where acute blood clot in the lung can develop. And this can be very fatal unless treated with blood thinners. So very important to recognize the symptom of acute shortness of breath that can be because of clot in the lung. Next. Now, heart attacks are less common in the long COVID phase, but certainly what is common is the first diagnosis of congestive heart failure, especially in people that have underlying comorbidities. If you have existing diabetes, hypertension, smoking history, and in women, there are a number of other risk factors such as premature menopause, high blood pressure, or diabetes in pregnancy. Those risk factors predispose you to higher risk of congestive heart failure. And you could have the first bout of congestive heart failure during the long COVID episode where the legs are swollen, you're experiencing shortness of breath, which can be exertional, which can be shortness of breath on lying down. It could be difficulty focusing. There could be heart palpitations. This conglomerate of different symptoms could be attributable to the diagnosis of congestive heart failure. Next. And lastly, not as common, but certainly seen, is inflammation of the covering of the heart or of the muscle of the heart, condition we call myocarditis or pericarditis. Now, typically this manifests as chest pain, but the chest pain is pleuritic. In other words, the chest pain happens when you take a deep breath, and when you exhale, the chest pain gets better. It's pretty constant, but worse on taking a deep breath. So if you're experiencing symptoms of chest pain that comes on with breathing, it could be a sign that there is inflammation in the muscle of the heart or in the covering of the heart. The other thing that happens with pericarditis is often we'll see that there is fluid buildup around the heart, and that is dangerous can certainly make cause a drop in blood pressure, but also can make the patient extremely short of breath. Next. So getting down to what are the cardiac recommendations to optimize health as far as reducing the cardiac manifestations of long COVID? Well, for one, the things that cause heart disease, diabetes, high blood pressure, or metabolic syndrome, that is weight gain with high blood pressure and high triglycerides. If you have these conditions, then optimizing them is the first step. So if you're a diabetic, making sure you're on your insulin, metformin, your blood pressure medications, and they're optimally treated. With metabolic syndrome, optimal treatment of triglycerides, managing it and achieving an optimal weight is important to reduce the symptoms of long COVID. Next. So this has already been alluded to by Dr. Somani, but this pyramid is recommended by American Heart Association, where these trials that are observational trials, certainly not randomized, but has been shown that in long COVID, taking nutrition rich in antioxidants and fiber actually will reduce the symptoms of long COVID. I'll not spend a lot of time because this has already been alluded to. Antioxidants in fruits, berries, nuts, and green vegetables, cruciferous vegetables, and then a diet low in saturated fat. And this is the pyramid that's recommended by American Heart Association, in recommending much more fruits and vegetables, legumes, some seafood, less dairy, less eggs, less chicken, less red meat. Next. And there's also observational data that optimizing sleep is important for long COVID. And this is just a just a reminder of what can optimize sleep, whether it is having a sleep ritual, mindfulness and relaxation before sleep, a consistent sleep schedule, avoiding caffeine, and avoiding high carbohydrate diet before sleeping. Next. And lastly, I'd like to point out, that has been alluded by my co-panelists, that vaccinating, especially for people who have underlying comorbidities, whether it's diabetes or hypertension, getting the boosters will reduce the risk of long COVID. So that's important. Getting antiretrovirals like Paxlovid has been shown to reduce the illness and reduce the incidence of long COVID. Thank you so much, Yalimadad.
Thank you, Dr. Qamruddin. So much important information. We spent so much time already hearing about coronary artery disease, to hear the effect on hypertension. It's so important that we be aware of that and continue to work on reducing our risk factors, given that particularly South Asians are such an increased risk of cardiovascular disease. So thank you for that. So again, I'm just going to make a quick comment. Please do go to the Q&A area and go ahead and put in your questions. We'll go ahead and start with some of the questions that we have already received, and we will go from there. For brevity, I'll proceed with first names if everyone is okay with that, and we'll go ahead and begin. So I'll start with the first question. What can we expect regarding COVID infections in 2025? So I will pass this one to Asif.
So in 2025, the COVID that I have experienced, I have seen is not distinctly different than some of the other common viruses. Some of the peculiar symptoms still remain, such as a lack of taste and smell. Obviously, having a high index of suspicion and testing them is the way to go. But luckily for us, the symptoms are almost indistinguishable from some of the common viruses out there. So I think now it's habitual for most places, urgent care hospitals, to add COVID testing to the panel of usual viral testing that they do, and then if they have COVID, then treat them early.
Thank you. Our next question is, should we continue to take new doses of COVID vaccinations that appear every year? So I can go ahead and take that. Yes, would be my response, and for a few different reasons. Each of the COVID vaccinations are different. They are particular to the strains of COVID that are most prevalent in the community. And as we saw earlier, COVID infection reduces time to recovery, reduces the rate of having long COVID symptoms. And also, even if the vaccination happens after the infection, that can also reduce the risk of long COVID symptoms. And then the other thing I'll say is just given the wide variety of symptoms that can happen from long COVID, some of us have other medical conditions that we're already working to manage, whether it's, asthma, COPD, heart disease, other illnesses like that. And so it's really important for us to do whatever we can to prevent something like long COVID from making those symptoms worse. So I would definitely recommend it to everyone. And speak with your primary care provider about how to access them because they can be expensive in the pharmacy, but there are affordable ways for every single person to be able to get access to the COVID vaccinations that we should be seeking. All right, let's see. All right, so here's one for Sana. How does long COVID compare to other post-viral syndromes in terms of neurologic complications?
So yeah, I think that question was also very similar to one other person I actually answered in the chat, that when will this end? This is a very common question we get. I think there are many similarities in terms of the mechanisms of inflammation and the prolonged recovery that we've seen. So there are many viruses in the past which have these prolonged conditions, usually called myalgic encephalitis or chronic fatigue syndrome is the most common term. But the differences are also there. I don't think other viral syndromes have such an increased prevalence of autonomic dysfunction like I had talked about, the heart rate and the blood pressure changes. And then most of the post-viral syndromes had clearer recovery timelines. So, would happen for like 6 months or 7 months maximum, but we're now going to 5 years. So just last month, I was looking through the news and it just said CNN, BBC, like it's been 5 years since COVID, but people are still reporting symptoms. And that is long COVID. We don't know when it will end. It remains kind of unpredictable because we're still in terms of studies or research, we're still in the early time window. We're just 5 years away, but it's quite unpredictable, I would say.
Yeah, no, thank you for that. I just want to highlight, there was another question that came up. How long can COVID last? How many years? Someone in the audience discussed, having had it for multiple years and feeling brain fog and fatigue and various symptoms. So just to your point, this is something that is still being studied. And right now, we don't know how long COVID can last. And so part of the research is going to be trying to understand sort of the duration of these symptoms, as we extend into a longer period of time of being able to observe and study this. I did want to just add a note to that comment. There are services within the Aga Khan Health Board to provide second opinions on, your particular experience. And so please do contact your Aga Khan Health Board member in your Jamaat Khana and ask them about how to access the second opinion services because those can be very helpful, particularly for if you have specific questions about a personal experience that you've had. All right, so let's keep going. I see a question here for Salima. Can you name the most concerning cardiac symptom after COVID that should be investigated immediately?
I would say chest pain. Chest pain would be number one, and palpitations would be number two. Certainly, again, so a couple of things. One is I think these symptoms can be very non-specific depending on, who it's happening to. But what I do want to emphasize is that patients who have underlying comorbidities are at the worst risk of having cardiac conditions. So please, if you have diabetes or hypertension and you've had it for a number of years, or you have other chronic conditions such as rheumatoid arthritis or lupus, or you take immunosuppressants for whatever reason, I think those patients are at high risk for having cardiac conditions. So those symptoms should be taken more seriously. The other thing I want to allude to is what you talked about, Faiz, is the fact who should get COVID vaccine. I want to make sure to impress on the fact that if you have diabetes, hypertension, malignancies, autoimmune disease, chronic diseases, you need to take the COVID vaccine. For the general population, again, the booster, the activity appears to last 3 to 6 months. So please be very careful. If you do have underlying conditions, you need to wear a mask, avoid people that have active COVID infection that you're aware of. I think that's important to take care of yourself.
Perfect. Thank you, Salima. Also, I'll just make one additional comment. There are individuals in the community who cannot receive vaccines due to taking immunosuppressive medications or having a condition that affects the immune system. So again, this is an important conversation to have with your primary care provider about vaccines in general. And also another comment to those of us that can receive vaccines, that part of the benefit of that is also we're protecting those around us who are unable to get those vaccines for themselves. So just a small detail. Thank you for bringing up the autoimmune sort of aspect. All right, so I have a question here for Asif. What is the general cause of the prolonged lingering cough, and how would you treat it other than basic treatment?
Yeah, so just backing up and just looking at the pathophysiology of a typical post-viral cough. In general, viruses reduces a human sensitivity to common allergens or irritants in the environment. Some of the common things, dust, irritants that would not affect, a lot of people. The tendency for us to react to these irritants go up, and generally that irritability, gets better within 6 weeks to 3 months, which is called a typical post-infectious or post-viral cough. So COVID follows the same pathophysiology because in most cases, not all, inhaled steroids and even other class of inhalers called anticholinergic medications would help. And I personally have had, and I think in the literature there's been some success in people with post-COVID cough, especially the anticholinergics. I think they are still underutilized because a lot of primary care physicians and other specialties are still quick to put people on oral steroids and even inhaled steroids. But it's the anticholinergic effect which really works in post-viral cough, and it has worked in COVID as well. So I think an early referral and probably use of combination bronchodilators would help. But some patients would still be a curveball, and I always say to my patients, if I can't fix your cough, I can at least suppress it until the thing fixes itself, and sometimes that has been the case in post-COVID cough patients.
Thank you. Here's another question, and this is I've been experiencing migraines and brain fog ever since I had COVID in 2021. Is there any way of alleviating these symptoms or any research on this? Having had this experience for the last few years. And obviously, as we have talked about, this can be a very difficult experience, and we thank you for sharing that, and hope that some of the material has been helpful. I would like to invite Dr. Somani or Sana, if you could share maybe some of the details of how to manage brain fog. I know we touched on it briefly, but maybe a few key points.
Yeah, the main thing for brain fog is, first of all, to make sure that you've excluded other stuff. So like I mentioned before, thyroid disease, vitamin deficiencies, all can lead to that too. So just make sure you're not having any of those things which are contributing to it. Once we've alluded that, okay, long COVID is what's causing the brain fog, the main thing is energy basing, which I had mentioned, and other things, just common lifestyle changes that would help too with brain fog. So yeah, these are just some of the things. Eventually, I think it will all get better, but I think there are some changes which need to be made. If we're waiting for a magic drug to happen, that will probably not happen anytime soon. So just before we get to that, I think just making those lifestyle changes, making sure you're conserving your energy well, and going with that will probably help the symptoms most.
Thank you. I'll just add another thing. There's a few different aspects that I wanted to mention. this can be very difficult to describe to other people, to family members and to friends. And at least for family members, I think like bringing your family sometimes into the clinic to kind of have the medical provider also discuss maybe what is this symptom and what are some aspects to be aware of can be very helpful for just other people to understand in the family maybe what you're feeling. And the other thing I would say is, everybody's experience is very different, but one thing I sort of realized from some of the preparation for this talk is that I think communicating with friends and family about some of those challenges can be helpful because sometimes there can be adjustments to how you spend time with another person or the kinds of activities you're involved with that can help sort of maintain some of those experiences. There were some experiences that I was reading about of people, secluding themselves or becoming less willing to interact with other people because of feeling significant fatigue and some of the brain fog. So those are just some general ideas without knowing the specific details of that that I'd want to add. All right, so let's go to another question. This one is for Asif. Can people develop long COVID symptoms with only one COVID exposure or having multiple exposures?
Yes, so the general answer is one COVID infection can definitely lead to long COVID. But if you look at scientific literature, as most of you have alluded to, the severity of the first or the only one COVID infection and also multiple infections increases your likelihood of having long COVID. And that's where comes the importance of repeated vaccination so that we should not think of one infection as natural immunity because we know that it's not effective and long lasting. So, yes, definitely the more infections you have with every infection, your incidence and tendency to long COVID would go up.
Okay, great. Here's a question, and I'll leave it open. What does CBT what does CBT and rehab look like? Like, what are those treatments in practice? And I think anyone can respond. I can take a stab at it as well. So cognitive behavioral therapy involves regular visits with a mental provider, a psychologist. And those, usually involve multiple visits in which, there are sort of conversations about identifying experiences as they occur and sort of being able to make a plan to address them. Just some typical thoughts on therapy. This is something that takes time. It's not a sort of 1 or 2 visit type of therapy. It's typically done over months and longer. And so I think it's really important if that is something that your medical provider recommends to you, that it is something that you sort of carry forward for a period of time before making a decision as to whether you feel like it's helping or not. And then physical rehab involves typically going to a location where physical therapy is done. They typically have access to materials and tools that can help you carry out a series of exercises that can be focused on different sort of joints or muscles or sort of overall fitness. And again, this is another form of treatment that occurs over a period of time that can involve several months. And so having that sort of expectation of progress, and that typically also can be accompanied by exercises to be done at home on a regular basis. So hopefully that provides some detail. All right, so we'll keep on going. Here's another question for Asif. What is the natural history of long COVID in most patients that you've seen?
Yeah, so again, it's pretty variable. As we know that, the obviously the scientific data is still we haven't had too long of a time period to say what is the average time span. But in the limited, research that we have come across, 50% of long COVID symptoms get better by the 1 year mark, and almost 3/4 of them get better by the 3-year mark. And obviously we are still waiting for more long-term data. If in some minority of people they will end up with persistent debilitating symptoms, but in general you can expect most of the COVID related symptoms, life to be hopefully back to almost normal in majority of cases by the 12 to 18 months mark. And I'll take some input from my other colleagues as well, especially we deal with different symptoms. Does that hold true for other organ systems as well? Because every organ system work at its different pace. So my answer is probably on the lines of pulmonary symptoms.
Anyone else want to mention something in addition? We can go ahead and proceed then. So here is a question. I've heard that the COVID vaccine and booster shots have many side effects. Can you explain why getting vaccinated is still important? Also, I apologize if this sounds naive, but is a COVID infection the main cause of long COVID, or can long COVID symptoms also result from the vaccine? So does anyone want to respond, or I can take that as well?
So definitely long COVID has been identified that, as you mentioned rightly, the working definition includes having a serologically confirmed case of COVID and then persistence of symptoms beyond 3 months. So definitely that's part of the definition. But on the other hand, it's true that a lot of post-COVID symptoms, especially venous thromboembolic disease, has been very commonly identified after COVID vaccines. In my, again, clinical practice, I've seen a lot of patients presenting with symptoms, and the only chronologic risk factor for these symptoms, whether it's a venous thromboembolism or a pneumonia or some kind of an acute illness, was post-COVID. So, the problem is, I'm sure you will agree that COVID has been such a hype up disease, rightly so, that every little thing that happens, everyone thinks that this is something that is new. But vaccines, have given rise to problems in the past as well. The thing is that it still, in majority of cases, prevents severity of the disease. So sometimes we have to just take vaccine as yet another medication with its due share of side effects.
Absolutely. And then I'll kind of comment on the second part of that. So is COVID infection the main cause of long COVID, or can long COVID symptoms also result from the vaccine? And I just wanted to highlight the study that I mentioned earlier, that in patients who had COVID infection, but who had the vaccine, they tended to have lower rates of long COVID, even if the vaccine occurred after the actual COVID infection. So whenever sort of the studies compare groups that received the vaccine to those that didn't, they do notice a decreased rate of long COVID. So there's no known risk of long COVID from, the COVID vaccine itself. All right, and then so there's another question here. Are there specific tests to identify or diagnose long COVID, or is it determined by clinical presentation? And so it is clinical. Going back to the definition, we talked about it's a post-infectious condition lasting at least 3 months, affecting one or more organ systems. And so when we look at those symptoms, a lot of those symptoms like shortness of breath, breathlessness, and other symptoms, they're sort of identified through conversation, through that discussion with a health professional. Although COVID can include other diagnosable conditions. So autoimmune disease, Dr. Qamruddin mentioned hypertension. There are diagnosable conditions that can come about in response to COVID, but it is sort of a diagnosis based on observing these set of symptoms in a certain time relationship to having a COVID infection. So there are not currently any blood tests that are able to identify whether something is or symptom is due to long COVID or not. All right, so I think we are almost out of time. So let's go to a final question for each of our panelists. And that is, what is your key takeaway point from today's talks? So I'll go chronologically on my screen. Let's go ahead and start with Dr. Qamruddin.
I think, first of all, the first thing I'd say is all my co-panelists talked about how optimization of health is the key to preventing long COVID. So if I had to take one message home tonight, it is that if you are having a healthy diet, optimal sleep, and optimizing your underlying risk factors, if you have any, I think that is the key to, just like all viral infections, I think that is potentially true for other viral infections, including flu as well. I think that is potentially the biggest thing. And the other thing is that the symptoms that are long and persistent, it's worth asking what the problem is. And is it going to go away in a year, or is there something you can do to make yourself feel better?
Yeah, and then Dr. Najmuddin?
Yes, I would echo Dr. Kamruddin's comments. This virus, right from the get-go, from the area of hospital medicine and critical care medicine, unfortunately, this virus has emulated the Darwinian theory that is survival of the fittest. This is one unique disease in which pill or in short is not the answer. I tell my patients this is one unique disease in which physicians and nurses will not cure you. In this is one unique disease in which 75 or 80% of treatment will be done by you. For example, in the ICU, the moment the number of hours you stood upright and proned yourself, that determine how quickly you recovered. In no other disease, it's on you. So and especially this is a Jamaati webinar, it's very important for our Jamaat to understand that from the time they get COVID, and if they're having the slightest symptoms of long COVID, unfortunately, it is up to them to rehabilitate themselves. In this illness, rehabilitation is the strongest pill you have. And I think that's the message I would like to give from this presentation.
Great. I'll go next. I also just wanted to highlight this topic of like stigmatization that, this idea that when people would discuss their experiences, sometimes others would say, oh, like it's going to go away soon, or it's probably not that big of a deal. And so I just wanted to highlight that, there are people around us that are experiencing these symptoms. And some of those may be physical, and we may hear someone cough, and others may be invisible. They may be but very significantly affecting someone's quality of life. And I think that we don't have to know that they have long COVID. They can have, any type of medical condition, but sort of being understanding of, the ways in which this might be affecting another Jamaati member, and being open to sort of listening about that experience, and providing care to each other, and accommodating when maybe someone has difficulty meeting with a group or going out, and trying to make sure everybody feels included, even if they're not able to do necessarily the same things they were able to do before. All right, and then Dr. Somani.
So yeah, I think long COVID is a good reminder that recovery isn't always straightforward, and the brain in particular can take its time healing from this aftermath, most of which is focused on cognitive rehab, like Dr. Najmuddin mentioned. So it is important to give yourself the space and time to heal, and pace your energy. That's my key takeaway from this.
Thank you, everyone, for your attention over this webinar. Thank you for your engagement with the questions that you provided, some sharing your own experiences. I want to thank our panelists who have taken the time to put together these presentations and present from their perspectives. And just very grateful for us to have had the opportunity to discuss on this important topic. So thank you for joining us tonight. There will be a survey link that will appear as a pop-up. So please do complete that. You'll also receive an email from Zoom with the same link. So please do either one of those. As much as we enjoyed presenting to you and hearing your questions, we also want to hear your comments about the format of the presentation and how we can improve these types of talks in the future to make them most useful for you to get the information you'd like to know. So once again, thank you for attending. There will be a recording of today's webinar on the Aga Khan Health Board website, and that link is akhb.thesmileyusa.org, and it'll be up within a few days. So thank you everyone again, and Yalimda.